Hi, my name is Charla Sarabia. I'm the Injury Prevention and Community Outreach Coordinator here at the Trauma Program at Mount Sinai Morningside, and today I'll talk about how to prevent falls. In order to make your home safer from falls, removing home hazards such as clutter, inadequate lighting, using appropriate footwear, using non-slip mat or rugs, and removing unstable furniture are one of the best things you can do to make your home safer from falls. Absolutely. There are several lifestyle changes that you can do to prevent falls. Regular exercise or physical activity can improve your balance, strength, and mobility. Exercise programs such as Tai Chi improve all of these aspects and has been proven to prevent falls. It is also important to review your medications with your doctor as certain medications can increase your risk of falling. Another thing that you can do is to do home modifications. Home modifications such as removing clutter, installing handrails, using non-slip mat or rugs, removing unstable furniture are one of the best things you can do to make your home safer from falls. And lastly, having regular eye checkups and a healthy diet can improve your vision and also improve your overall health to help you prevent falls. Most falls are caused by a combination of risk factors. The more risk factors an individual has, the greater their chances of falling. Factors that are responsible for falls can be classified into two categories: intrinsic and extrinsic. Intrinsic factors are factors that are related to an individual. These factors can include changes such as declines in vision, hearing, mobility, as well as chronic health conditions such as Parkinson's, stroke, dementia, arthritis, diabetes, and medication side effects. These conditions can cause physical impairments, balance problems, and coordination difficulties. In addition, these conditions can also cause cognitive impairments, dizziness, and confusion. On the other hand, extrinsic factors are outside influences like environmental hazards. Environmental hazards can be clutter, improper lighting, inappropriate footwear, having unstable furniture, and using non slip mats and rugs are very important to make your home safer from falls. Therefore, it is very important to be aware of these risk factors and take the steps to address them in order to decrease your risk of falls. Yes, certain medication can increase your risk of falls. Some examples of these medications are pills for sleeping and anxiety, depression, pain medications, and antipsychotic drugs, which are used to treat schizophrenia and other mental health disorders. It is important to talk to your doctor or pharmacist if you are taking any of these medications and are concerned about falling. Your healthcare provider can explain the side effects of any medications that you are taking and can suggest strategies on how to minimize your risk of falls. Falls can have varying consequences depending on the person's age, health status, and the circumstances of the fall. For instance, falls can result into minor injuries such as cuts or bruises that can be treated with basic first aid. However, falls can also result into more serious injuries such as fractures, especially in older adults. In addition, head injuries ranging from minor bumps to traumatic brain injuries can also occur after a fall. Besides from the physical injuries, falls can also lead into psychological effects. For example, a fear of falling can lead to a decrease of physical activity, mobility, and lead to social isolation. Therefore, it is really important to seek medical attention after a fall, especially if you're an older adult or have underlying health conditions, and to avoid the potentially serious consequences that can result from a fall. If you are concerned about falling, it is probably a good idea to talk to your doctor, especially if you're an older adult or have underlying health condition. You should see a doctor if you had a fall, a near fall recently, unsteadiness on your feet, have difficulty of walking, or have a fear of walking, or have a fear of falling. Your doctor can recommend certain tests and provide referrals to specialists such as a physical therapist to improve your balance, strength, and mobility.